Good afternoon, and today we have a pleasure of interviewing Dr. Jackie Jones. Good afternoon, doctor.
So nice to be here.
And Dr. Jones is Associate Professor of Cornell Clinical Otolaryngology, Weill Cornell uh, School of Medicine. And she graduated from Smith College and from Cornell University Medical School. She's been elected from Castle Connolly top doctors in the United States, and she's been selected 100 top Black physicians in the United States. She's co-founder of Vaccinate for Love, physician-led nonprofit organization that provide vaccine education to certain communities. And she's also best-selling author of the book called Medical Parenting: How to Navigate Health, Wellness, and Medical System for Your Child. So today we're going to find out more about the book, and also very hard question we're going to ask from Dr. Jones: what's the signs of sleep apnea in children? And we're going to discuss a hard question of snoring a lot. So please tell me, doctor, what are the signs of sleep apnea in children?
Well, the biggest sign of sleep apnea in both children and adults is snoring. It's almost impossible to have sleep apnea without snoring. So that's the big cardinal thing that we need to watch out for.
And a lot of parents complain on a child snoring at home. They're concerned about that. Tell us, what's the treatment for such a condition?
Well,
What happened exactly in the ENT office if a parent come with a child?
Absolutely. So snoring can be just benign snoring. Many children snore when they have colds. What we need to watch out for is if the snoring is habitual, meaning happens every single night. The snoring is very loud, like in your child, you can hear it from the door. And if there's any pauses in the breathing, and that's in both adults and children. So if any of those things are happening, snoring is very loud, happening every night, or pauses, you bring you or yourself or your child to an ear, nose, and throat doctor's office. And in the office, we primarily are looking in the mouth, and we're looking for enlarged tonsils. The next thing we'll do is look in the nose. And the way that we'll look in the nose is the teeny little scope. We look in the front of the nose, and we look to see if there's any blockage. Now, that's not painful. And most children tolerate it very well, and adults always tolerate it well.
And again, thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, please click the like and share button. This way you can help us to spread the news about our channels. And we explore different aspects of sleep apnea and snoring and other difficult trouble breathing and sleeping. And we offer support for those who are going through different therapy for obstructive sleep apnea, and present adjunct remedies to help with treatment. Also, we create a network of professionals who are passionate, like Dr. Jones, about helping people sleep and breathe in the same time. Because I would like to create a community of medical and dental professionals who can work together and put all the puzzles of that disease and find the solution. Only collaboration can help us. And also, I would like to encourage you, use our channel as a networking ground. This way you can communicate and find the great advices and solutions from great physicians like Dr. Jones. So my next question to you would be mouth breathing. What's your opinion about that?
Well, as you know, Maria, mouth breathing is not something we like to see on a chronic basis because what it does is it dries up the saliva in the mouth. And the saliva has such a protective effect for our teeth and the lining of our mouth. So when we mouth breathe, we really do put our teeth and the lining of our mouth at risk. In children, mouth breathing can have even longer term consequences because the way that the jaw, both the upper and the lower jaw, develop is the teeth fit together, and that tells the teeth and the jaw where it should be. So when the mouth is always open, there can be unrestricted growth, and we can end up with elongated faces and problems with the teeth. So really nipping that in the bud early is very important.
And now I'm going to ask you the hot seasonal question. Now is the spring, everything is blooming. Allergy is really fashionable now. So it's allergy season. Tell me, what's your treatment approach towards allergy?
Well, it is. We are really gonna have a bad allergy season this year, so everyone needs to be on guard for allergies. So the primary thing is to keep your nose well lubricated and rinse out any allergens, and that's by using saline nasal spray, and those are over-the-counter spray bottles or drops that you can use on your child to rinse away allergens. Looking at your environment, and with some of the big allergens, especially for those of us in New York who are inside a lot, is dust and mold. So vacuuming, dusting, checking your air conditioner before you turn it on and make sure there isn't a lot of mold. And, if your symptoms are bad enough, looking at over the counter allergy medications. And some of the more popular ones are the antihistamines, and there's Zyrtec and Allegra and Claritin are some of the more popular ones. Also, some of the steroid nasal sprays like Flonase and Nasonex. Those are some of the more popular ones. Those are things that can be used in conjunction during allergy season to bring down the swelling in the nose.
I think it's so important because if nose become black, people open the mouth.
Yeah.
And we don't want that, as we learned
No.
what that mouth breathing is not good at all. It's not healthy. But I see a lot of patients in my practice. They are mouth breathers and they have enlarged tonsils and adenoids. And I'm curious to ask you, Dr. Jones, what's primary? Mouth breathing and irritation of the tonsils, or vice versa? What do you see in your 35 years of practice?
Thank you. So in kids, the primary reason for mouth breathing is enlargement of the tonsils and adenoids. So you have the anatomical blockage first. They can't breathe through their nose because they have large adenoids, which sit in the back of the nose, or recurrent upper respiratory tract infections, and then they start mouth breathing. In adults, the reason can be multifactorial why people tend to mouth breathe. But again, the primary reason is going to be nasal blockage. And when the mouth dries out, as we were talking about before, then that can cause inflammation of the tonsils. And when tonsils become inflamed, then they can get bigger and you get into this chronic cycle. So really addressing that early is going to keep the tonsils healthy.
And my question on that, if, of course, we would like to know more how, treatment happened, but if somebody got a treatment already, can they automatically start breathing through the nose?
No, it takes time, especially in children. They've been mouth breathers for a while, and you take out the tonsils and the adenoids, you relieve that obstruction. It takes a while for the brain to switch over to knowing that it can breathe through the nose. So it's not instantaneous. So the therapies that you may be doing, either speech therapy or myofascial therapy, it's important to continue them for a length of time. It can vary up to 6 months to a year to teach the brain and the muscles in the oral cavity that yes, it's okay to breathe through the nose.
Yeah, it's a very questionable topic and we deal with it every day. But
Right.
a lot of parents, they, concern about snoring, but they want to know exactly. Like if my child snore loudly and he's kind of restless too, how, what to do if my child snore loudly and how we can navigate from there.
Well, there's so much pressure on children in schools these days, as you know, and it starts really, really early. So there's an increasing awareness of ADHD, attention deficit hyperactivity disorder, and we have to make sure that ADHD isn't due to sleeping problems because as adults, when we get tired, we go take a nap. For children, they become hyperactive, and that may be one of the warning signs that they have sleep apnea is this hyperactivity with snoring. So if you have a child who has ADHD and has snoring, you really should go for an evaluation first with your pediatrician and then with one of the health professionals like you and I.
So basically, the first thing would be like if you see somebody, like if somebody bring the child, if I bring my child to you who snore, what would be the first thing would happen?
Well, the first thing I do is do an examination to see if they have enlarged tonsils and adenoids, or if there's other reasons why they're snoring. And then I'll go on to sometimes I'll ask parents to make a sleep video where they'll take their phone and they'll record sleeping for about 5 to 10 minutes. And that's a wonderful thing to do before you go to a sleep professional or even your pediatrician. Film your child sleeping for just 5 or 10 minutes. We don't need a long time. Have the lights on, pull their nightgown or their top up so we can see the chest, to see the level of obstruction, and turn the sound on so we can see how much snoring there is. So if that's suggestive, one of the next things we might do is to do a sleep test, and that can be performed at home. And there's companies that will send a machine for either a child or adult. It's an overnight sleep study, and it's just like a band-aid that goes around the finger, a little band-aid that goes on the upper lip, and a little sticky that goes around the chest. And what it can tell us is if there's sleep apnea, and that can be performed at home. So really, really useful.
Really useful before you start with the medication for the child. I think it's very important to find the root cause of a disease.
Absolutely, absolutely. We really need to be careful how we over medicate children. And as you said, get to the root cause of the problem.
Yeah, and a lot of parents concern, is that going to be painful? Or parents, not only children, everybody concerned that exam. What exactly happened on that exam? If it's going to be painful.
It is not painful. It's a teeny little scope. It's like half the size of a straw that goes into the nose, and we put numbing medication, just topical. It just drops in the nose, lidocaine like you might get in a dentist's office, and that numbs the nose. Then we look with little scope, and the exam really takes less than a minute in most cases, very, very quick. And I would say the vast majority of children tolerate it, and it's very, very rare for us not to be able to calm down an adult and talk them through it. So it's quick, easy, and so helpful to make a diagnosis.
Very, very important. I would like to ask you, what are different reasons for snoring between children and adults?
Well, in children, as we were talking about before, one of the primary reasons is enlargement of the tonsils and adenoids. And that's the reason the vast majority of children get sleep apnea. Now, secondary reasons are recurrent colds and upper respiratory tract infections. And we see that type of snoring during the winter, but that type of snoring does not usually lead to sleep apnea. In adults, snoring and ultimately sleep apnea can be multifactorial. It can be due to blockage of the nose from a deviated septum or polyps. It can be blockage in the mouth, and that can be from enlarged tonsils, though not as common in adults. It can be due to a retrognathic jaw that's posterior. It can be due to a large tongue. It can be due to a lot of different reasons, and that's why it's important to consult with both a dentist and an ear, nose, and throat doctor to get at the root cause of why in adults we're snoring. And one of the big things, as you know, that can cause snoring is overweight. So losing some weight is really something that can help snoring. It's also good for your health.
And I know we talk about a new approach to surgical procedures for snoring for kids, actually, or maybe for adults. Please tell us about tonsils and adenoids removal in more conservative way, because I think it's like for me personally, I think it's important organ to have tonsils and adenoids. I always feel bad when people have it totally removed. So please tell us about that new procedure, what you're doing now.
Absolutely. We're much more conservative with surgery on anyone now, as I'm sure you are too. We don't want to do surgery if we don't have to. If we can treat it medically, let's try and do that first. But there's some cases we really do need to defer to surgery. And one of the newer procedures, and I say newer, probably in the past 10 years, newer procedure is shaving the tonsils and adenoids down. And that's where we take out probably 97 to 98% of the tonsils. So we take out a lot of the tonsils and the adenoids, but we leave a little tissue in. And the advantage of that, it's less painful, less chance of having any complications. And children and adults, again, much more common in children than adults, but in both groups, it's, they're back to sort of normal activities much, much quicker.
So they still gonna have portion of tonsils, but it's not gonna be obstructive, right?
Exactly, exactly.
That's very good thought. So please
Yeah.
tell us about your book and what inspired you to write your book on a medical parenting. And I have your book, and I highly recommend for my readers to read your book. And you can find information about Dr. Jones on a link. And also, Dr. Jones is going to give us a gift on the chapters of her book, and it's going to be in a link after the interview. Please
Wonderful.
tell
Well,
us about your book.
great. Thanks so much for asking. My book, Medical Parenting, How to Navigate Health, Wellness, and the Medical System with Your Child, was really based on my 35 years of experience as being a physician, but it's also based on my experience of being a mother. I've raised two boys, so I know how hard it is as a parent to navigate that system. Maria, you and I know how complicated the medical system has become. Doctors and dentists are pushed more and more to see more and more patients. We have less time with patients. So much is online. Registration, your results, it's becoming more complicated. Just don't walk into your family doctor's office anymore and be the only person there. So how do you as a parent and as an adult navigate that system? And that's what my book helps you. Each chapter looks at how you set up an appointment, how you navigate the secretaries, how you get to the doctor, how you structure your time with a medical professional, because maybe they'll only have 15 or 20 minutes with you. How do you make effective use of that time? And there's also chapters on nutrition, on getting your child ready to go to school, and even how to launch your child off to college. So I really enjoyed writing it. I'm so glad you got it. Thank you.
No, no, no. I think it's a great book, and it's what I like about you. It's a very clear, structural, advices. And I want to mention again yes, when you visit your doctor, you have to be ready. Like that advice about video of your child sleeping. That would help. It would help me to see how child's sleeping, help orthodontist to see how child's sleeping, and to help ENT. You basically bring the picture on a table instead of, I don't know, you're the doctor. That doesn't help.
Yeah, it doesn't help. You're
So
absolutely right. Yeah, you're absolutely right. The "you figure it out, I don't know, you figure it out" thing really isn't the way we want to partner with patients. And that's why I love
yes.
working with you, Maria. We are partners with our patients. So patients have to take some initiative too. We're in this together. So the more information that you can give us, the more that we can help you.
And my last questions would be, how does multidisciplinary team work together to address adult and the child snoring? So talk about our team,
Yeah,
how we
and
work together.
yeah, absolutely, and we've worked together, I think it's gotta be 6 or 7 years now, and it's such a pleasure to work with you. And what we wanna do is we wanna work together to address sort of the multifactorial reasons for snoring and for problems with breathing, and it can be in the oral cavity, and that's where I send a lot of patients to you, especially adults who may need oral devices or, need to have their jaws examined or TMJ, and you send patients to me who may need surgery or who may need to be scoped to see if there's blockage in the back of the nose. So that's where a multidisciplinary team really works together. And, we look at sleep studies together. And, I just tell a really quick little story. My son's girlfriend texted me yesterday. I saw someone and they told me that I need to have oral surgery because I'm not breathing well. But no one had really looked at her nose. So, and she has terrible allergies and she turned out to have polyps. So, oral surgery wouldn't have really helped her problem. So that's why we need to work together. So to look at both areas and get the best possible outcome for our patients.
Thank you very much, Dr. Jones. We really enjoy our interview. Really appreciate.
Great. Thank you so much for having me. I really enjoyed it.